I'm Carl Mercurio with Healthcare Week in Review. We're here with Jonathan Cohn, senior editor of The New Republic and author of Sick, the untold story of America's healthcare crisis and the people who pay the price. Jonathan, thanks for joining us.
Thanks for having me.
Well, this book is very good. I thought you did a wonderful job of painting a picture of the problems with the U.S. healthcare system, particularly the U.S. health insurance industry. And the book also does a wonderful job of painting some heartbreaking stories of people who have been left behind. I wanted to quibble with you on one word in the title, and that is the word untold. It seems to me like these stories have been told over time, and it's not that we don't know that there's a problem, it's that we lack the political will to do anything about it. Is that a fair assessment?
Well, I think it's true we lack the political will, and that's part of what makes this story untold. I think from the standpoint of who I profiled in the book and why I chose those people, I wanted to demonstrate the fact. I think most Americans are conscious of the fact that, yes, I've heard we had 45 million Americans who don't have insurance. And yes, I know that sometimes that isn't a great situation, but I tend to think they believe, well, that couldn't be me. That couldn't be me in that situation. And even if it did happen to me, it wouldn't be so bad. So one part of the untold story is the fact that, well, no, actually that's not true. Being middle class, having a good middle class job is no guarantee of health security. And the other part of the untold story is the connection between, well, what's happening and the way our healthcare system is designed. I believe there's a direct connection between the choices we've made politically over the years and what's happening today.
Yeah, that brings me to sort of my next question is you make the point that the stories here are not representative, but they're indicative of a problem. And is that really the problem? People say to themselves, well, this just isn't going to happen to me, so I don't have to worry about it?
I think politically that is the problem. I think, if you know the history of healthcare in this country, we've had discussions about whether to create a universal health insurance system time and time again. And one reason we've never made the decision to do that is that people who are insured, and at any one time most people do have health insurance, people feel, I think, sufficiently secure in that situation that they decide, well, I really don't want to make a change. Change isn't worth it because, after all, what do I have to gain from it?
Right. Your book advocates a single-payer system. And just to clarify, single-payer is when the government takes over health insurance, running health insurance, basically. There have been a lot of calls for universal health care. For example, the one in Massachusetts going on right now. That talks about a partnership between health insurance companies and the government. Can that solve the problem, or do we have to go to a single-payer type system to solve this issue?
Well, I do think single-payer systems are the best, certainly on paper. And for people who think that may sound foreign, I always remind them that Medicare, in effect, is a single-payer system for the elderly. That said, I am open to other solutions. If you can insure everybody through a plan like they have in Massachusetts, or you can do it through some way like the Clintons tried to do in the early 1990s. I believe some of those can work also. I'm not against those. I think at the end of the day, single-payer works best, but if you can do it through an individual mandate, which is what they're doing in Massachusetts, well, more power to you.
I have a line here I wanted to read to that point. Insurers are wary of covering individuals with serious medical problems, and HMOs applied extra scrutiny to their treatments because those people run up big bills, which the insurers will end up paying. Hospitals try to keep out the uninsured because treating those patients will just divert hospital resources away from paying customers. And while these actions may sometimes seem unsavory, they are actually perfectly rational, entirely predictable reactions to the incentives of the marketplace. That doesn't sound like the system will work with the health insurance industry in there.
Well, you can make it work, I believe, if you regulate it properly, if you create a level playing field. I mean, why do employers look to cut back on their health benefits? Because they know that if they don't, one of their competitors might. So if, for example, you create a system where all businesses are required to pay the same amount, then you've leveled the playing field. And that's why, for example, you have men like Steve Bird, who is the CEO of Safeway, is now a very vocal advocate of universal health insurance. He would like a level playing field so that he's competing with Walmart, and he wants to know that Walmart can't undercut his prices simply by offering less generous health benefits.
You've been traveling the country promoting your book and talking about this issue. What's been the reception of both the media people that have interviewed you and some of the organizations that might be affected by this?
Well, I think there's a general interest in this subject. I think most people realize we're about to have another great national discussion about health care reform. There's a fair amount of optimism out there. I think everybody is exasperated with the way things have become, and it is starting to seep in that not only is our system cruel, but frankly, it's just very inefficient. It's not just unfair, it's stupid. So there is a lot of interest in doing something, but of course saying that you want to do something and then actually creating a universal health care system are two very different things.
And then finally, as we stand here in the Nasdaq Market Site and the gods of industry look down on you, we did a little assessment of the value of the stock market capitalization of health insurance companies plus the not-for-profits, came up with about $300 billion in value, thousands of employees. This business would effectively be put out of business under a single payer. How do you make that happen in this country?
Well, obviously, you need to show a little humility when you're dealing with such a large share of the economy. And I'm always reminded of the fact that if you tour low-income neighborhoods, for example, you will find that many, many people, even majority of people, are actually employed in the healthcare business. So you need to be thinking about the effects. These are people's jobs. Uwe Reinhardt, the economist at Princeton, likes to say a dollar of one person's waste is still a dollar of somebody else's income. Right. So if you think about bringing down costs, it needs to be done gradually, and it needs to be done in a way that you're promoting efficiency so that in the long run, as you are cutting back the waste, you're creating new wealth elsewhere. Obviously, nobody is suggesting, I don't think anybody reasonably suggests that if we create a single-payer system, tomorrow we'll go from spending 16% of GDP on healthcare to 11%. The idea, I think, is more that over time we can cut down on the increases that we in healthcare spending, squeeze out the waste, and then use that money for better purposes.
Great. Thank you very much. The book, again, is Sick, The Untold Story of America's Healthcare Crisis and the People Who Pay the Price. From the Nasdaq Market Site, I'm Carl Mercurio.